Okay, well, thank you everybody for joining us today. This is one of the CoStar Network's webinar. We've had a series of these. We normally have one every month, and I'm very excited that this time we're going to have two presentations, both related to health in coastal communities. So the first presentation is going to be about health determinants research, or from the Health Determinants Research Collaboration in North Yorkshire, Understanding and Addressing Health Inequalities in Coastal Communities. And that's from Jane DeVille and Rachel Moore. And then second, we're going to have a presentation about young people in coastal communities and mental health. And that's from Emily Murray from the University of Essex. So two really interesting and very relevant presentations. I'm just going to explain a couple of things about how it will work this afternoon so that everybody knows what's going on, and say a few things about CoStar before we go into the presentation. So first of all, just to let everybody know, the presentations and the webinar today is being recorded. If you're wanting to interact with us, people's videos and sound are turned off. So if you want to ask questions, and I really would encourage you to ask questions, you need to use either the Q&A function. The Q&A function is the easiest way to do that and the easiest way for us to collect together questions. But I am also aware that some people won't see that. Depends on what version of Teams you're using. So you can also ask questions in the chat as well. But if you can, use the Q&A for asking a question, because it is a little bit easier for us to manage. And then I'll be able to relay questions to the presenters at the end. And what we're going to do today, because the two presentations are very closely linked to each other, we will have the two presentations and then take all the questions at the end. So if you have questions, feel free to type them in at any point in time, and we'll bring those together at the very end of the presentations. So just before we begin, just a quick reminder to everybody about the CoStar Network. So a couple of updates and things we'd sort of encourage you to engage with and look at. There's always new blogs appearing on the website. And in particular, you might be interested in looking at the 8 new projects that we funded, which are all related to strengthening coastal resilience. So there's 8 new projects by early career researchers who are leading all of those. So I'd encourage you to have a look on the website and find out what people are up to there. We will be having a webinar in the near future where they introduce those projects, so you can find out more about what they're doing. Also, important to say that we have published our Year 1 report on coastal change and transition in the UK. So again, if you go to the website, which unfortunately looks like it's the end of it has been trimmed off there, but ukcoastalresilience.org. If you go to the website, you'll be able to look at our Year 1 report. So again, I'd encourage you to do that and see what we've been up to and find out more about the project overall. So after telling you a little bit about the project ourselves, we're going to go into the first presentation. So first of all, we're going to be looking at the Health Determinants Research Collaboration in North Yorkshire. They're going to be talking about understanding and addressing health inequalities in coastal communities. So Jane and Rachel are going to give that presentation. So I will hand over to them and they will take over the screen from me. So Rachel and Jane.
That's great. Thanks, Stuart. Thank you. I think Rachel's going to share the slides. That's great. So good afternoon, everybody. I'm Jane DeVille and I'm a researcher at Holyoke Medical School. I'm presenting to Rachel Moore, who she'll probably tell you a little bit about herself, but she's Public Health Officer at North Yorkshire Council. And we're working together on a programme called the Health Determinants Research Collaboration North Yorkshire. Can I have the next slide, Rachel? So we're just going to tell you a little bit about the HDRC, what it is and what we do. And then Rachel's going to talk about some of the challenges on the North Yorkshire coast and about how she's preparing a coastal health needs assessment that will help drive some of the work that we're doing as a HDRC. Next slide, please. So I'm going to start by telling you a bit about the Health Determinants Research Collaboration, or the HDRC for short, because it's a bit of a mouthful. It's a 5-year programme that's funded by the National Institute for Health and Care Research, and they aim to create a culture of research within local authorities, where staff begin to make decisions around health inequalities that are based on evidence. And if evidence isn't available, they learn to begin to carry out research, often in partnerships with academics around the wider determinants of health. So there's a network of 30 HDRCs across the UK. You can see where they are on this map. We are by far and away not the only one with a coastal community. Quite a few of them do have. They're all collaborations between local authorities and universities. So at HDRC North Yorkshire, we're a collaboration between North Yorkshire Council, the University of Hull and the University of York Centre of Health Economics. But we're really looking to work with academics beyond those two universities as well. So within North Yorkshire, we've currently been working with council staff to carry out a training needs analysis, to look at what training they need to start them to think about using evidence and research. And we've begun to develop a research governance framework that will eventually include ethics. We've started work on research culture, which includes things like having academics to talk about their research at regular research cafes to interested staff. And we've begun to develop academic partnerships around a range of different projects, some of which are based on the coast. So the HDRC really sees itself as being a catalyst for research. So we're working alongside the staff at North Yorkshire Council to help them think about using evidence and carry out research. Next slide, Rachel, please. So all of our work is really based around the wider determinants of health, and I think these are quite important when we think about coastal communities. So almost everything that we do has an impact on our lives and our health. So for example, housing, do we have mould on our walls? Do we have access to high quality education? Are there safe green spaces where we can all be active? Is there public transport? And people's experiences of these services and of poverty and deprivation all affect their quality of life, their length of life, and how long we have a good life for. So we know that men in the most deprived areas of North Yorkshire, some such as those that are sometimes seen on the coast, can die up to 9 years earlier than those in the least deprived areas of North Yorkshire. And the local councils, that's North Yorkshire Council, have responsibility for quite a number of these areas, so transport, green space, housing, education. So we can begin to see that their services can have a real impact on these wider determinants and how people live. Next slide, please. So as part of our work as a HDRC, we have 5 broad research priority areas that are shown on this slide, and then we have 3 under-research groups as well that we're focusing on. I think most of these priority areas have some type of link to coastal communities, but due to the importance of these areas in North Yorkshire, we've got a separate place-based priority, which is around the health and wellbeing of coastal and rural communities. And that's one of the research areas that I've currently got responsible for looking after. Next slide, please. So this slide really just explains my role a little bit more. It means that I'm working with Rachel and other staff within North Yorkshire Council to try to identify issues of importance and develop collaborations with academics. So these are some of the things that I do within my role. I'm really there to connect academic staff to help them use their research within policy and to build those trusted relationships. So that ultimately staff at North Yorkshire Council are using evidence and research within their decision making. Next slide, please. So I thought I'd just give a quick couple of examples of work that's happening along the North Yorkshire coast as a result of the HDRC. We have one of the CoastR funded projects that Stuart's just mentioned that's working with communities in Scarborough and Whitby. So that's staff from the University of Hull working alongside North Yorkshire Council staff from the Environment Directorate to develop a toolkit. The local authority have got responsibility for a flood risk management plan and shoreline management plans, and they're all due to be renewed soon. So it's hoped that some of the research work that's looking about how residents understand and value coastal change will feed into those new plans. And we've also got academics working with VCSE organisations alongside the council And one example of that is some work that's taken place with a community group in Scarborough, Kafka. They've been funded by the Yorkshire Policy Innovation Partnership to look at community food growing spaces in Scarborough. And again, that will feed into the localities team at North Yorkshire Council as part of their Food for the Future plan around food insecurity. Next slide, please. So thinking about research and working with academics and identifying issues along the coast, one of our next steps is to identify some areas of research interest for coastal communities. So areas of research interest are published documents which detail key research questions and evidence gaps that are being faced by those organisations. They're regularly used by policy bodies. So, for example, a lot of UK government departments have them in the What Works centres, but they're also increasingly being used by local councils. So they aim to connect academics with policymakers by identifying research needs, and they give opportunity for collaboration and ensure that evidence-based decision-making is used in policy development. So in a moment, Rachel's going to talk about the coastal health needs assessment that she's currently undertaking, and that's hopefully going to provide us with some data and information that we can start to develop some ARIs and research questions for North Yorkshire Council around coastal communities. Next slide, please. So just to finish, this is a brief example of what those might look like. ARIs are usually themed. So in this example, I've given a couple of possibilities around housing and economic opportunities. And then there are questions to be answered where current evidence is weak. So it's hoped that policymakers from North Yorkshire Council would then communicate with an academic audience so that your research can fit more strategically with the needs of the organisation, and we can begin to develop those partnerships. So I'm going to pass over to Rachel now, who's going to talk a little bit more about the health needs assessment and life on the coast in North Yorkshire, so you can begin to get a bit of a flavour of some of the things that our ARIs might cover.
Hi there, can you hear me okay?
We can, Rachel, yes.
Thank you, thank you. Yes, I'm Rachel Moore, I'm a Public Health Officer with North Yorkshire Council, and we're just going to have a quick look at the Coastal Health Needs Assessment and a bit of an overview of what we're doing. So these are the areas that we're going to look at in the presentation, and we're going to have a think about some of the indicators around wider determinants of health and deprivation particularly. So coastal communities are unique, and it's important to understand the challenge of these communities. Across England, coastal communities face distinct and persistent patterns of deprivation that shape health and well-being of the residents. Often we think about coastal communities, about leisure and tourism, but they do also experience deep-rooted social, economic challenges linked to historical shifts in industry, seasonal economies, population change and geographical isolation. So here is a list of some of just a few reports on coastal health. One in particular to draw your attention to is the Chief Medical Officer's report in 2021. So he reviewed the health challenges for the towns, cities and coastal communities and felt that it was it's a serious challenge. The coastal communities have more in common with each other than their nearest inland neighbour, and they also share common patterns of health disadvantage regardless of their location around the country. They have higher levels of major disease, lower life expectancy and higher burdens of physical and mental health conditions. Also within the council, there's various strategies and plans that have highlighted rural and coastal issues, and they're therefore a focus for reducing health inequalities. The need for a coastal and a rural health needs assessment was also highlighted as part of a peer review that the department took part in. So you can see on here the aim and the methodology that we've got. I think just wanted to cover what a health needs assessment is. So it's a tool we use in public health. It's a systematic approach to understanding health inequalities and well-being between groups of people, and are shaped by factors, as James described, what we call the wider determinants of health, income, environment, access to services, education, etc. So the health needs assessment can focus on specific diseases, population groups or interventions, and it results in developing some recommendations that help to target resources. They involve working in partnership and also involve stakeholders, service users and the community. For the coastal health needs assessment, we're focusing on place-based health inequalities, and we're using a mixed methods approach. So we're looking at the quantitative data sets that we've got available, the resources that OHID, ONS fingertips, etc., and also some qualitative interviews that we took that were done. So there's no agreed definition for coastal when looking at this kind of work, and it's been something we've spent quite a lot of time talking about what it's going to look like for us. So we're using the former Scarborough Borough Council area, which is broken down into 14 MSOAs, so middle layer super output areas, which is a geographical unit of used in small area statistics, and it provides local data, so it gets a bit of that granular detail, but also offers privacy. And so there is an issue with using MSOAs though. So we've got an MSOA that would include a coastal village of Lythe, has quite a small, very small population, but within that MSOA there are various other small villages, Danby, Botton, Glaisdale and Egerton, which aren't coastal. So we have to be mindful of that, and we'll try and use the stakeholder feedback to support providing information on the smaller coastal villages. So the structure of the report is around place, people and prevention. This is a structure that's been used for other reports in the council, particularly the Joint Health and Wellbeing Strategy and the Rural Health Needs Assessment. So have a quick look at a few indicators that we've been reviewing. So look at here, we've got deprivation. So the indices of deprivation is a data set that's recently been updated to 2025. The 7 domains of deprivation to include income, employment, education, health, crime, barriers to housing and services, and living and the living environment. Each domain is then weighted to make a combined index of multiple deprivation, which is what you see here. This is on LSOAs, which are lower super output areas, which are smaller still. But what it's really useful for us to do is to use this because it identifies the pockets of deprivation within North Yorkshire, which aren't always easy to see. So the indices of multiple deprivation here highlighted that 23 neighbourhoods in North Yorkshire fall within the most deprived quintile in England. And of those, 19 of those are within the coastal area concentrated in Scarborough Town and Whitby. 83% of the population of North Yorkshire who live in the most deprived neighbourhoods live in former Scarborough Borough Council area, so the area that's on the map. The bar chart illustrates that none of the lower super output areas attributable to the coastal villages are within the most deprived quintile, compared to 35% of the lower super output areas from the coastal towns that are within the most deprived. So this map shows the whole of North Yorkshire and looks at the wider barriers subdomain. And this uses indicators of housing affordability, household overcrowding, homelessness, patient to GP ratio, to name a few. The majority of the coastal area shows low or moderate levels of deprivation for this subdomain. But there are 3 of the 5 LSOAs that make up Eastfields, Crossgates and Seamer MSOA within Scarborough Town, within the Scarborough Town area, and they fall within the most deprived quintile. So you just see it on the coast here and this slightly bigger area here. So that we can see there's commonality in the areas that are being picked up by the different indicators. So just have a look at housing. So some of the key issues around here is that the majority is owned outright, and it's higher than the England average. And there's the market, a rental market is particularly significant in the coastal towns. Something additionally to look at is around over occupancy and under occupancy. So rates of over occupancy in the coastal villages and towns are similar to North Yorkshire average, except for Scarborough, which is just slightly higher. So the North Yorkshire average is 1%, Scarborough's just slightly higher at 2%. The under occupancy, however, has a higher proportion for the coastal villages of under occupancy at 52%, which is above the North Yorkshire average of 45 and the English slightly lower average of 36. So that's something that we can pick out around the coastal villages. again around housing. So we're looking at the types of heating that's available for the houses in the area. This is particularly of interest at the minute with the ongoing issues around oil. So we've got Whitby and Scarborough have our mains gas levels similar to England, and are actually higher than North Yorkshire, probably due to the rest of the rural nature of the county. For the coastal villages and Filey, 3% of households use bottled gas versus 1% in England. And Filey and the coastal villages have more homes using 2 or more types of heating than in England. The coastal villages also, like I said, there's 18% of homes there using oil only versus 12% for North Yorkshire and a really low 3% for England. So this is really quite significant given the current situation. So there's particularly low house prices in Scarborough areas, and the low house prices are often linked with poor housing conditions, quality, size, and a recognised driver of poor health and well-being. Some information here around second homes. It's identified that concentrations of second homes rise local house prices, reduce affordability for permanent residents. This is particularly evident in the rural and coastal areas of North Yorkshire, and we've got the 5th highest in England level of second homes. It makes it particularly difficult for young people and newly formed households, and there's an impact on the local economy. Second homeowners generally tend to be middle-aged or retired, and they're unlikely to want to work locally themselves. There's some census information here, which is you have to take it with a bit of a pinch of salt, but around the MSOAs, so for Filey and Hunmanby and Esk Valley and Runswick Coast, 6.1% of dwellings are identified as holiday homes, so that is significantly high. So just a quick look at employment issues. So employment is a major challenge for coastal communities. ONS states that half of coastal towns have experienced decline in employment compared to non-coastal towns between 2009 and 2018. Self-employment is also high amongst residents in coastal towns. Poor employment prospects underpin many drivers of poor health outcomes. So we've got the chart at the top. It's the proportion of working age people who are involuntarily excluded from the labour market. So we've got higher levels of involuntary excluded from the labour market, reflecting seasonal employment, low job availability, and limited access to stable employment. The coastal villages show lower levels of employment deprivation, have a stronger employment resilience. And the second chart there is looking at the proportion of full-time jobs. So overall, the coast areas have a lower proportion of full-time jobs than North Yorkshire and England, highlighting a labour market, again, characterised by part-time, temporary, seasonal employment, which influences income levels, job security and wider economic resilience of the coastal communities. So I've got a bit of a breakdown of different types of jobs here. So overall, there's a high dependence, as you would expect, from tourism and hospitality. That's particularly evident in Whitby and Filey. There's a strong service-based sector, yet fewer high-skilled service roles compared with national averages. There's a sizable health and social care workforce, particularly in Scarborough. And this was picked up by the Chief Medical Officer, highlighting that there's issues around recruitment and retention of staff in health and social care down the East Coast. There's another thing, interesting issue is around manufacturing in the coastal villages. So it seems to be higher, so I wonder if it's around the rents in urban areas, or perhaps using converted agricultural spaces, or diversification opportunities from farming occupations. So it demonstrates some of the strengths and the vulnerabilities of the North Yorkshire coastal economy, characterised by seasonal tourism, low wage sectors and limited diversity. We've got economic activity. So the particular interest here is around the self-reported worklessness due to retirement. So retirement is higher in North Yorkshire coastal communities than the national average, reflecting the older age profile. It's particularly evident for Filey town, with the highest proportion of elderly of retired population, with over 50% compared to England at 25%. This impacts on health and social care demand, whilst also having a reduced working age population. We've got transport now. So the CMO report states that poor transport connections, peripheral locations and long distances to employment are challenges in coastal areas, along with the limited awareness of opportunities outside the local area. And we've got literally half the opportunities available to other inland people due to the sea, restricting access to services, reducing catchment areas for economic and health services. So here, the indicator that we've got on the map there, it's around it's based on the connectivity score for, of each neighbourhood, as calculated by travel times to retail, education, health, employment, leisure and entertainment destinations by walking, cycling and public transport. There are higher levels of challenge to access key services throughout the coastal North Yorkshire, with the exception of the centre of Scarborough. All parts of the coastal villages fall within the most deprived quintile nationally of this indicator. And those living in coastal areas have considerable travel times involved in making journeys. So we've got restricted links beyond the coast, A64, which is mainly single carriageway, the rail and bus links, which also take considerable time and cost, and can be pretty tricky to navigate, particularly if you're wanting to access specialist treatment in larger hospitals. So we've shared some of the example indicators that we've been looking at. Like I say, these are just some of the examples. We're including more in the report around education, crime, digital connectivity, and there's more. The Health Needs Assessment acts as a tool to support collaborative working, so to develop initiatives and interventions to help reduce health inequalities, and obviously developing the links with Jane and the HDRC to look at the areas of research interest that we can find within the Health Needs Assessment. So thank you for listening. So I'll stop sharing just now.
Great. Thank you very much, both to Rachel and to Jane. That was a really interesting presentation. What we'll do is we'll move straight on to the next presentation from Emily on young people in coastal communities and their mental health. So Emily, if you'd like to share your screen, then we'll start your presentation, and just remind everybody to either use the chat or Q&A to ask any questions, and we'll come to those after Emily's presentation. So thank you, Emily.
Hi, can you hear me? Sorry, I'm just thinking about the presentation before. No, that's fascinating. Can you see that it's full screen now?
It's all good. That's great.
Oh, okay, good. It's a bit funny talking to like a blank screen, but do my best. So I'm going to talk about young people in coastal communities and mental health. And I'm director of the Centre for Coastal Communities at the University of Essex, and I grew up in a coastal community in Florida, so it's also personal as well. So I probably don't have to tell the room this, but we have a crisis of youth mental health in England, that there's 1 in 5 children, young people, have a probable mental health disorder. And these percentages have doubled since 2010. So this started before COVID, just an upward trend in prevalence. And then, of course, this has led to higher NHS mental health referrals for children and young people. And it's almost doubled between 2020 and 2023. But something we know is that the prevalence of poor mental health is not spread evenly across England, like we were just seeing in North Yorkshire, not even within regional local areas. that you see a much higher clustering, of higher prevalence in urban centers and specific coastal areas. But, so I'm showing you this map here on the left of, this is prevalence of mental health for all ages at local LSOA. But we have no publicly available data on just young people's mental health. So that's my campaign now, is to be able to get that nationally at a granular level. And trust me, I've been trying. So if anybody here knows, let me know. And of course, talking about the CMO report that, came out, I guess 5 years ago now, really showing that some of the worst health and well-being outcomes in England are in coastal areas. And not just about mental health, but across the board. Saying heart disease, that's what the map here on the right, my right, is showing the red areas where highest prevalence of cardiovascular disease. And of course, you see that kind of north-south divide, but also that kind of coastal, higher prevalence on the coast. And some of this being due to high proportions of older people, like we were just talking about, retirement areas. But actually in the CMO report, they were showing that some of the highest prevalences of poor health were in where populations were relatively young. So, I had read this with some colleagues, and this is ecological data. So this is just area level data. And we said, let's do something about this, look at this further and see what's going on here with longitudinal data, individuals. And we said, do coastal youth have worse mental health than their peers inland when you look in individuals? And as the previous presenters were saying, there's no established definition of what is and is not a coastal community. So for this work, we end up repeating what the Chief Medical Officer had done with lower super output areas, so those neighborhood level. So I think there's about 2,500 people per LSOA. And we use their definition of it has to be in a built-up area and lie within 500 meters of this mean high water mark on the coast. But I think not wedded to this definition, but I think this is what we're using for now. And you can see there's some other different definitions. We were kind of trying to say, like, if you used this definition, the dark blue is the CMO one. ONS also has one, and we were trying to say, like, what would you get a different answer if you used a different one? But it doesn't seem like it. And we said, okay, we're going to use this national data set called Understanding Society. So they interview, starting in about 2009-10, have a representative sample of the UK. And they have a youth sample of 10 to 15-year-olds. So you're getting young 10 to 15-year-olds, representative of the UK. We could just use England because that's all that definition that we had for coastal. And we said, okay, let's look at where they lived when they were 15 years old. Do they live in a coastal area or not? And then we had 11 waves of data that we could follow up and say, what's their mental health like up to 11 years later? And what I'm going to show today, there's different ways of measuring mental health outcomes. I'm going to show mental functioning. So they said, here are these 6 questions. I haven't shown those questions here, but they said, based on these 6 questions, do you have high functioning? Do you have low functioning of mental health? There were other measures about psychological distress, which basically shows the same thing, so I'll just show this one. And as I said, for this paper, we used 12 waves of data. They've since added more. Actually, I think they've just released wave 15. So it's a really nice data set if you want to understand what's going on in UK society and look at it over time. And just very briefly, what came out of the first study is we wanted to look at, so this figure here is showing along, the y-axis is mean MCS, which is mean mental functioning. Along the bottom is area deprivation. So 5 being the most deprived areas they lived in, and 1 being the least. And the lines are showing whether they're coastal or inland. So the dotted line is coastal, and the non-dotted one is inland. And what you can see is that in the least deprived areas, there really isn't a difference between mental functioning between the coastal and the inland areas. You know, these kind of lines are quite close together. But when you get out into the most deprived areas, you see this widening in mental functioning. So it's showing that the young people who were in deprived coastal areas had much worse mental functioning if they were on the coast than if they were inland. And that was quite surprising to us, because we thought maybe you'll see this difference in mental functioning, but it will be explained by area deprivation. But it wasn't. It was saying there's something coastal, some additional coastal mental health gap in the most deprived places in England. And we didn't just see this for mental functioning, we saw it also for psychological distress, and we saw it for limiting long-term illness as well. So quite robust. And this is after adjusting for lots of things about the individual and their household. So gender, age, ethnicity, household income, tenure, housing tenure. Just trying to make sure I keep to the time. But the next question was, we wanted to say, what is it could be about the coast that would be causing young youth to have worse mental health? You know, there's lots of research out there showing that living by the coast is good for your mental health and well-being. You know, the blue space. You know, lots of people move to the coast for those reasons. You know, they mentally feel better going on the beach. People go to visit the coast, etc. So why are you seeing the opposite here for young people? Is it something about the coastal environment, or is it something about the economic, social challenges of people that live there, or is it about healthcare? And I don't have to tell this group about social and environmental challenges of some of coastal communities, being this economic story of coastal towns once being thriving centers of commerce, but so many of them have experienced these stark economic declines. And so I think particular coastal areas that were our seaside holiday towns, fishing, shipbuilding industries have seen this economic decline, and that, you know, creates this kind of cyclical situation of high deprivation levels, seasonal economy, outward migration of young people, poor quality housing, etc. So it's got kind of this feedback group of poor health with poor economic situation. And so how do we actually measure this? So Linked Up tried to find as much publicly available data at an LSOA neighborhood level of what is the environment going on around these young people. So we look at the economic environment, about jobs, about mean gross value added is productivity. Is it something about social environment? Is it about schools, about crime? You know, do you have adults around you who have qualifications, who have skilled occupations, who can teach you that? What's the educational environment like? So this is like attainment scores and progress to higher education is polar. And then what's the built environment like? So lots of stuff showing that mental health, urbanicity is related to mental health. If you have a mental health problem, can you get to the GP? Can you get to the hospital? And other environmental things that have been shown to affect mental health, like gambling shops, being able to get to employment centers, that kind of thing. And what this is showing here is that if the arrow is red, that means on average in England, the coastal areas have worse levels of these factors than the inland areas. So very crude comparisons, but it was much more about the economic, social, educational environment that were, whereas the built environment there wasn't really that much difference. When I present this, I always like to say that there is some good news. If you're in a coastal area, you've got more green space and you've got less air pollution, which is definitely related to cognition and mental health. But one of the things we saw is that this same pattern where the coastal areas had worse environmental exposures was true for our survey members in understanding society. And it was true even when you just looked within the top 20% most deprived areas, which I was also quite surprised about. So I think even when you're comparing the coastal to the inland areas with high deprivation, the coastal areas have worse levels of these things, which I think goes to explain some of the health inequalities. And I just wanted to give a very quick overview of like what that looks like, and particularly if you look in the middle here about mean higher education participation. So this is in the top 20% most deprived areas of England. The coastal areas, about 22% of people are going on to participate in higher education, whereas in the inland areas, that's almost double that, almost 40%. So there's a massive difference in higher education participation between coastal deprived and coastal inland areas. And I think recently the government has announced a coastal mission for education, and I think it's desperately needed here. And I hope to hear more about, no actual details on what that will involve, but I'm glad they're doing something. But the surprising thing is when we looked at these environmental factors and were they actually related to young people's mental health? Only 2 of these factors were related to mental health after you adjusted for the information about the individual household social circumstances. So that was crime in the local area, and that was participation in higher education. It was interesting. And when we said how much of those things explain that gap, coastal mental health gap, it was saying about 16% of that was actually more about the social circumstances of the household, and about 8% of that was explained by the participation in higher education. So we only were able to explain about 25% of that gap, and still a lot of it left to explain. So I'm interested to see what other people have to say. And then the last one, really quickly, just to say, this is about mental health services. Yes, also as well. So we went on to look at, well, if someone indicates that they are psychologically distressed, have they been diagnosed with a mental health condition? So have they been diagnosed, trying to get it, have they been treated for this? And we saw the same kind of pattern here, where if you look, it's only in the most deprived areas that the coastal youth have much higher prevalence of undiagnosed mental distress than the inland youth. So it seems that there is both, that young adults living in the most deprived coastal areas have like this double whammy of poor mental health. So they're both rating their mental health lower. And if they do have mental health issues, they're less likely to be diagnosed. And so far, the explanation seems to be more about the economic and social challenges of people living in coastal communities, particularly around household incomes and private renting, but a lot left to explore. And we're going to get to do this in Greater Essex. We've got some funding from NIHR, Mental Health Leader Award, to really investigate what's going on with young people's mental health there, particularly around loneliness and social isolation, because that's something our local partners have told us is a real issue. But for time, I wanted to say, if you want to contact me after this, I'm really happy for you to do so. I think we've got 5 minutes. And I'm happy to share the slides. So if you want to go read the papers and stuff, please do. Sure.
Great. Thank you, Emily. That was really interesting presentation again. And both interesting presentations. What I'd like to do is open it up to questions from the audience. Just put up a slide there so we can see, because we don't get many video cameras on this. So yeah, somebody's put their hand up. If you've got a question, if you could type it in either to the chat or the Q&A, and then I'll replay the question. So, but first of all, Guy Cooper was asking and saying that many of the communities that they speak to regarding adaptation to coastal change talk about feeling abandoned or forgotten. Is this something that comes through in your research? I wonder if that is just a general feeling, I guess a general feeling for people on the coast and not just specifically related to flood and coastal erosion risk management. That might be something for Emily and for Jane and Rachel to answer. So yeah, yes, is it they just generally feel abandoned or forgotten, or is it something related to the sort of physical location?
I don't know who wants to answer first, but I'll say I think it's both. I think it's particularly with young people, when you talk to them, they talk about like this, there's not opportunity there for them. So they either have to escape, they have to go somewhere else, or they feel stuck where they are. Yeah, and just like a hopelessness. And I think particularly during COVID, etc., just I think people have said to me like it was just like watching our town die. And yeah, this kind of feeling of being left behind and not a lot of opportunity, and that how that plays into poor mental health and etc. But I think you're on mute.
Yeah.
I tend to agree that in North Yorkshire it's both as well. I think there's just that feeling of being on the periphery. So that's both geographically on the periphery and sort of on the periphery of any services that are offered as well. Often it's further for people to travel to things. I think like Emily says about people maybe not wanting to stay in that coastal area when they're young, they move elsewhere. So yeah, definitely both of those issues.
And then another question about how, I think this relates more to the first presentation, that the sort of stats that you had, but again, Emily, I think it might apply to you, how the coastal regions compare to those indexes elsewhere in the country, which I think you sort of touched on partly, but yeah, yeah. I think the question is, yeah, how do these regions compare to the most extreme coastal regions in the UK? So are the places you've looked at I guess the most problematic coastal regions, or is it where yeah, do you know relatively around the whole country how things stand?
I think that from Rachel's presentation there, the 19 neighbourhoods in Scarborough and Whitby fall within the most deprived quintile in England. So that's within the 20% most deprived areas. So those neighbourhoods. I think it's safe to say that Scarborough and Whitby aren't the most deprived coastal communities in the UK. Places like Blackpool and Middlesbrough, will be ahead of them. But I think the key is that when you look at the issues, they're often all very similar, regardless of where those coastal areas fall in terms of sort of the level of deprivation. So it's all generally tends to be around that low wage economy, the reliance on tourism, seasonal employment, the ageing population, decline of traditional industries. We could probably go on with that list, but I think across coastal communities, those issues are very similar. Rachel, I don't know whether you've got anything else you wanted to add.
I think the other thing is around not looking at the North Yorkshire coastline as one entity, and really breaking it down as much as we possibly can to find those pockets, which is something that we always it's something we come across often in North Yorkshire, that we have to really drill down quite to a low level to be able to see those areas. So yeah, like Jane said, they are there, but yeah, they're not as the areas aren't as big by any means as like of these like Blackpool and those areas, and those are the types of places that were included in the CMO's report. Yeah, North Yorkshire Coast didn't actually wasn't included in that, but yeah, not to say that we haven't got the same issues.
Another question from, oh, sorry, Emily, sorry, did you have something?
I think we're doing a lot of work in Clacton, Jaywick, which is one of the most deprived for a long time. But I think very similar issues, like you were saying, you know, Great Yarmouth, Lowestoft, Clacton, Blackpool, they seem like they have more in common with each other than their next door neighbours.
So yeah, another question from Daniel Johnson was wondering if you have any insights into how the qualitative health data can be integrated into the quantitative mapping of health inequalities in coastal communities. Is that something you've looked at or have any thoughts on?
Yeah, that's what we're going to be doing, that with NIHR mental health project, is integrating qualitative and quantitative. Yeah, because I think the numbers are, you know, they're very interesting and they give you an idea, but they don't really tell you exactly what's going on. It's really being able to drill down and talk to people where I've learned the most. Yeah.
It sounds like an exciting project. We'll definitely have to get you back to tell us more about that when it's happening.
Yeah.
I had one question as well about what you were looking at, because you said sort of earlier on that there was outward migration. I was wondering, is there, I think of youth, I was wondering, is it harder for those with mental health problems to move away from the coast? Is that one of the reasons why? Could that be one of the reasons why mental health problems are more at the coast, that there's a combination of problems which makes it hard? Because you said there's generally is an outward migration from coastal communities. I don't know whether that's something you can decipher.
That's my next grant proposal.
Right, okay.
I don't think we have the answer to that question. I do think I think it's both the inward and outward. Like, so I've been talking to people from the council, like Tendring Council, and they were saying, you know, they actually get lots of people like from London councils, not shipping people, but essentially moving to where the cheapest housing is, and that tends to be Clacton. You know, that's where they can afford, and maybe those families have mental health problems that they're bringing with them. They're saying they're getting people housed from the prison, local prison, and so it seems like there's a history, like a pattern of a dumping ground of people with health problems. So I think that is very real possibility. And then of course young people that are healthy and moving to opportunity, yeah, are potentially healthier than those who've stayed. But I don't know. I don't have research evidence.
Another question about what do you think that, again related to mental health, do you think that climate anxiety is particularly impacts young people in coastal areas, and whether or not arts and culture organisations have a role in terms of helping young people's well-being?
I mean, I think the people to ask about that is the other CoStar project that Gina is leading from, because that's what they're looking at. They're looking at in the east of England, you know, how to build resilience to climate change.
Yeah.
But they're just getting going with their experiments, their interventions.
Right.
But I don't think it's not something, just anecdotally, when I like walk around and talk to young people, and we have lots of young people from the coast at our University of Essex who go there. I would say it's much more about cost of living challenges and immediate day-to-day challenges than far off coastal anxiety. I mean, but yeah.
And just a question I had for Rachel as well. There's an awful lot of interesting data that you have there. I wonder whether any of it points towards where the most likely practical interventions might come. Does it suggest any of that, or is that really what is is that data to spark the research to try and find those? I was just wondering if there's any starters for people to think about.
Yeah, I think the research there to spark the those kind of questions. Yeah, I think we're still working on it and still weaving in the health data and the qualitative data. So I think we need to get that full picture probably before we're able to identify some areas. Although second homes does seem to be quite an interesting area. Yeah.
Great. Well, we're almost at the end of time there, so I am going to. There are a couple of other questions which perhaps our presenters, Jane, Rachel, and Emily, could maybe type answers to, because people can see the sort of chat afterwards. So if you had any thoughts on the other questions or comments there, that'd be great. But once again, thank you very much to Jane, Rachel, and Emily for some really interesting presentations, lots of interesting data and things for us to think about. And thank you again for presenting to us and sharing your data with us. We will be able to share slides with people, and the presentations will be available online for people that were asking about that, so people can catch up with it and find out more from all of that. So once again, thank you very much for your presentations, and if everybody keeps reading the newsletter that we publish, and the next newsletter should be out at the end of this week, you'll see forthcoming webinars that we'll be hosting, and please come along to those. Thank you.